Welcome, I'm Melissa Brothers, a surgical technician instructor. In this video, you will learn how to put on a surgical gown and gloves. Sterile surgical attire plays an essential role in maintaining aseptic conditions by blocking the transfer of harmful microorganisms and chemicals to and from the patient, and reducing the transfer of bacteria from the skin of the surgical staff to the air in the operating room. Let's go over the process for each one. The first step in preparing to properly put on a sterile gown and gloves is to open the paper wrap gown and gloves on a Mayo stand. You will then need to inspect and verbally acknowledge the integrity and expiration date of the wrapped items. Let's open the gown. Orient the package on the stand surface so that the outer package drapes the appropriate area. Open the first fold away from your body. Be sure to touch only the outer surface of the wrapper and that your arm does not cross over the sterile inner surface of the package. Also, it's important that you do not touch the table with your body. Then open the second and third folds to the side. And again, make sure your arm does not cross over the sterile inner surface of the package. Now you will need to open the last fold toward your body. Be sure to monitor the edges so that the unsterile ends do not move upward and contaminate the gown. The margins of the sterile surface are only the top of the package and 1 inch from the edge of the wrapper. We're now ready to open the gloves. To start, hold the item so that your thumb and fingers of each hand grasp the open tabs on the end of the peel pack. Then pop the item onto the field within 1 inch of the wrapper and without allowing the item to slide across the edge. Items that slide over the edge are contaminated and must be discarded. Remember, unsterile hands do not cross the sterile field edge. Now you will do a thorough hand scrub. Details about this procedure are available on another video. Pick up the towel correctly without dripping. Dry the first hand and arm beginning at fingers and using a twisting blotting motion. Bend at the waist to keep towel from touching scrubs. Turn the towel using other end and repeat the last step on your other hand and arm. Dispose of towel from appropriate height. Drop it from waist high, do not ball it up. Now you're ready to put on the gown. Pinch the gown in the middle, away from the neckline. Step back from Mayo stand and gently shake the gown open. Slide one arm in at a time without raising arms above head or out to sides. Keep your arms in sight at all times. Do not allow your fingers to extend beyond the cuff of the gown. Open gloves correctly, being careful not to touch the front of the gown on the Mayo stand. Place one glove on the correct hand with fingers pointing toward the forearm. Keep the palm of the glove on the palm of the upturned hand. Keeping the second hand in the gown, pull the cuff of the glove over the hand and wrist. Repeat the process for the second glove on the opposite hand. Put on the second pair of gloves using the same procedure as before. Now adjust the gown and do not turn your back to the sterile field. And remember, sterile perimeters are the mid-chest to waist, from the hands to 2 inches above the elbow, and in front only. Always keep the hands visible. All other surfaces are considered non-sterile. Now you know why it's so important to have sterile attire and how to properly put on a gown and gloves. To learn more, look for other videos on medical techniques and procedures.